Hi, I'm a former Purdue University Global student who graduated with a Bachelor of Science in Human Services, Family, Youth Services, and Administration degree. My title is Mental Health Technician at a behavioral health hospital, also known as a psychiatric hospital. The population that I serve is the mental health population that includes patients who are going through mental health crisis or breakdown, having issues with their conditions like depression and suicidal ideations, suicide plans of suicide, and actual suicide attempts. We have three different units: the child and adolescent units, ages 4 through 17, the adult units, ages 18 through 64, and the geriatric units, ages 65 and up. My main responsibilities in a typical week are psychiatric care, providing continuous care, intervention, and support to each patient, ensuring that their individualized plan that was created for them with their doctor and the social worker is being followed through. And examples of some of those things I do is watching the patients for high-risk behaviors that could escalate into self-harm or harming someone else. Assessing, observing, and documenting any changes in appearance, behavior, and the ability to work their program effectively toward their treatment goals and that have been outlined with them. So I do this by monitoring all patient behaviors through rounding every 15 minutes as a monitoring system, which is basically checking on every patient in the unit and charting that, A mental health tech takes and records vital signs on each patient every morning and night, also sometimes throughout the day, depending on the patient's medical history and what the doctor orders for them. Communicate any changes in a patient's health or their affect and mood, and communicate any of those changes with the charge nurse. I also help with new admissions by working with the EMTs on arrival. Myself and a nurse will assess that patient immediately, search their belongings, their clothes, all by hand and with a metal detector to detect any kind of contraband, sharp objects, drugs, and things like that, because they're not allowed on the unit. I properly store these items and anything that's going with them on the unit. All patients are required to agree to allow us to do this by signing and dating that we will hold all of their possessions in our locked property room until they are fully discharged. Sometimes I do have to restrain patients in emergency situations if they become volatile, or they'll try to hit you or hit another patient, or just become violent towards staff, or they'll be in psychosis or mania, and so we have to use what is called CPI training. It is a nonviolent crisis intervention training on how to de-escalate the situation without hurting the patient or trying not to hurt yourself as well. And then I log all of the incident reports into the hospital computer system, and I notify the proper hospital management of what's taken place, and including the event, everything about the misconduct or anything and everything that happened about that situation goes into MIDAS. I also handle hazardous and infectious materials such as urine and feces through using proper PPE and disposing properly as trained. Techs also take patients to the cafeteria for breakfast, lunch, and dinner, along with another technician that goes with you. And then one thing to mention is you have to obtain your CPR, AED, and CPI training in order to begin working on the units with the patients. And then that's something that you would have to maintain, I believe, yearly, sometimes every other year. So skills that are necessary for succeeding in this position are good communication skills, excellent communication skills, patience, sound judgment, empathy, and then the ability to provide those day-to-day needs for the mentally, emotionally, and developmentally disabled patients. What is most enjoyable, I would have to say, about my work is the one-on-one conversations with my patients when they open up about themselves and their families, their lives. I enjoy hearing that, and then I love to see them getting better, feeling better, doing better, and leaving the program with a smile on their face. They're happy to leave. Because they know what to do now, so they'll leave in a better mind space, if that makes sense. They won't feel so alone and discouraged, and they'll have built a stronger support system and be more in control of their conditions through medication adherence as well, and from learning new healthy coping skills. And what I like least about my work is when I work shorthanded or with team members that are not as engaged, or they don't really care about what they do. It can be disheartening and frustrating because the patients see that as well. And, they go there for help. So that can be disheartening. Some of the biggest challenges that I have faced in this position, I would say, is being physically struck by a patient and then seeing patients' health decline, that they're not getting better because they won't open up or they won't go to therapy, or they'll stay in their rooms. They'll choose to stay in the room and just sleep all day, or they're not working their program, as we say, because we do have involuntary patients as well as voluntary patients. Now, the involuntary patients are the ones that have been petitioned to go there, so many of them won't comply. Like, they've been court ordered to be there, so many of them don't want to comply, which can make it challenging when you're trying to help them. That can make it challenging. So when I first started working in human services field, I do wish I would have known that you really need to know what population that you want to work with, because working in a hospital setting can be completely different than working in like an office building or office type setting. It definitely can be completely opposite. I have had other jobs because of this bachelor's degree, even as like an ABA technician and things of that sort. But each has its own requirements, protocols, training, and certification. So every employer is different. So you just really knowing what field you want to work in, what population you want to work with, or age group or something like that. That really does help. So my advice for human service students, if you are unsure of what population that you would want to work in, or just be open to learning how to work in different areas and fields, I would say, because that's how you learn where you want to be, and it's okay to do that. You won't have a problem with your degree getting into most companies or even hospitals. I can tell you that. And just try working different positions, like I said, and try different groups, specific age groups, or what makes you feel comfortable. But just opening that up and being open to work in a different, environment, where you're going to thrive no matter what. Thank you.